Well, so I'm of course, as you know, our clinic is women's health based. So I'm going to ask you questions that are kind of like self-serving in a way where I'm
Yeah,
curious for our practice. When is the best time for a patient to come in to see you if they're pregnant? Is it better to come in pregnancy or is it better to come after they have a baby? I
great
hear a lot of
question.
patients asking about pelvic floor after they have a baby. And once they
Mhm.
start having pelvic floor issues and pain and painful intercourse and all the fun things that come with postpartum.
Yes. So I think that, one of the first ways that our field evolved was helping postpartum women with things like incontinence and prolapse. That was our
Mhm.
first sort of claim to fame. Um, but you ask, when should someone come? I mean, if you
Yes.
ask me in a perfect world, we would actually like to see people when people are trying to conceive.
Okay.
Um, at that I know that that's a kind of a long stretch because there's a lot of other things to think about during that time, but especially if you're having painful intercourse
For
or
sure.
some other type of issue, or you're going through fertility treatments and you're having a hard time tolerating some of those procedures with
Mhm.
speculums and that kind of stuff, we can help with all that kind of stuff. So if you're having issues with that, it'd be great to come. If you've already gotten pregnant, then we highly recommend coming. You know, I there's a little bit of protection that we all have as a society for first trimester, and
Sure.
especially if you're have had a fertility journey, I
Mhm.
get firsthand how that can be a very anxiety producing time. You don't wanna rock the boat, add any other variables in,
Right.
so I totally get that. If you're having any sort of symptom, like back pain, hip pain, anything like that during the first trimester, we can totally see you, and we won't don't have to do internal
Mhm.
um, assessments. So that's very safe to do. And but even if you're kind of like, I just want to focus on myself in that time, I might be feeling sick. I might be feeling nauseous and kind of just not very great in that first trimester, then we highly recommend you coming as early as possible. And our pregnancy program at Pelvic Sanity starts as early as you want it to. And then we help you to decide, what are your goals in pregnancy? What is your current status? Do you want to stay active? Do you want to be exercising? Are you on activity restrictions that we need to be mindful of so that we want to still be obviously aware of those, but there's other things that we can do with your nervous system and stuff like that to help
Mm.
promote a really healthy pregnancy. And so we might see somebody once a month during that second trimester,
Mhm.
um, kind of like how you're seeing your OBs, right? During
Sure.
that time. And then we can also see you if things start to crop up. So if you have any sort of back pain, pubic symphysis pain,
Yes. That comes up
round
a lot.
ligament pain, just
Mhm.
anything like that's I think that's another, myth that we can bust here, Tina, on this podcast is that I think so many times you would say, you go into your OB or your midwife and you're like, "How are you feeling?" And you're like, "Okay, I've got some swelling in my hands. I have some hand numbness and my back's starting to ache." And they're like, "Oh yeah, that's normal." And you're just kind of be like, "Okay, well, I guess I just have to endure that." I mean, and
Mhm.
just
That's
because
right.
there's a just because there's a reason for it, it can be explained by pregnancy, doesn't mean that that's how your 9 months has to be. So we can really help you through any of that to kind of optimize your healthiest pregnancy to stay as active as you want to. And there's a lot of people that want to keep doing their
Yeah.
HIIT
For sure.
workouts and their weightlifting and CrossFitting and running and that kind of stuff, and we can help you to stay as active as is safe and
Mhm.
help you to modify when it's appropriate, right? So that you don't have to stop everything either, because that's the other option that you see when you go to your OB a lot of the times is that they'll be like, "Well, don't lift more than 25 pounds," and it's, like, super arbitrary. Maybe you have a toddler at home that's 30 pounds, and now you're like,
That's
"Well, what the
right.
hell am I supposed to
Yeah.
do?" You know?
Yeah.
So those are the kinds of things that we can help to troubleshoot for you, and really help you to stay as active as possible, during all of that time.
You still there? You're back.
Yeah,
Okay.
yeah, yeah. Well, we'll just figure how RJ can fix that.
Yeah. Thanks, RJ.
Yeah.
And you were saying?
So what I was saying is that is just to make sure that you are, we can always address whatever, issue comes up so that you can maintain as as much exercise as you want to during your entire pregnancy. And so then, so we're talking about how long you should be or how when you should be coming in. So the pregnancy
Mhm.
program looks like that in the second trimester, sort of as needed. And then at about week 28, right when you hit that 3rd trimester, we really want to have you, come in pretty frequently at that point, like, maybe once a week to
Mhm.
really do talk about birth prep, um, and learn how to push well, talk about labor positioning. We can actually measure your pelvic floor muscle activity to make sure that your pelvic floor is relaxing, so that the if you're gonna have a vaginal delivery, to make sure that your pelvic floor is not in the way of the baby getting out. Um, we can help with all of the stuff that kind of inevitably starts happening. I mean, I feel like I've rarely had a person that has 0 pain or issue in any part of their body all the way in the 3rd trimester. You're
Right.
just getting bigger and it's just a little bit more uncomfortable. Uh, so we can help with all of that. And then we can also help if you don't have a doula, we can also help you with birth preferences, advocating for yourself, partners coming in and learning how to assist you during the first and second stage of labor. We have a really, we can talk about perineal massage to help prepare those tissues to stretch. And we
Mm.
also, no matter how holistic you want to be and how much you really want, uh, as low intervention birth as possible, which a lot of people at least around our area, want to do. We do talk about all of the avenues for epidural and C-sections just in case that we need to go down that road, because I
Sure.
feel like the biggest help against any sort of birth trauma is being aware and informed about the different things that can happen. And so we do talk about what happens if you have a C-section and what do you do in the first 2 weeks postpartum when everything gets crazy and everyone's talking about the baby and no one's talking about you. So
Right.
we
Right.
prepare you all for that as well.
I love that. What a comprehensive plan. I did not realize how often or, just that patients can see you all the way through and to prep for labor.
Yeah.
That's so interesting, fascinating,
Yeah.
because I think a lot of patients are, well, first of all, when you have a birth plan, everyone's really fixed on that birth plan, right?
Mhm.
And sometimes in a detrimental way, because as we all know as moms, things don't always go as planned in
Correct.
in the labor process. So,
Yeah.
but to be able to have someone to discuss it with and to be open, like, hey, this might happen. If you have a C-section, these are the things, right?
Yeah.
But
Or yeah, the other thing that can happen, and we see this a lot too, is people are like, give me all the drugs. I plan to have an epidural. Well, your first stage of your labor
right.
can go so fast that you might not be able to get one.
True.
So
That's true.
there it goes all the different ways. You know what I mean? Where we just at Pelvic Sanity want everybody to be prepared for all different outcomes, and then so we plan for everything, and then we also facilitate to try to hope for what you really prefer and what you really want. But we never want anybody to leave feeling like they didn't tell me that was gonna happen, because a lot of
Mhm.
times at the OB or even your midwife, like, they're not going over all that stuff, you
Yeah,
know?
they have a set
Um,
amount of time with you. There's only so much
yeah.
time in a visit, for
And so
sure.
we have the luxury of being able to really sit with you and go through with you all that stuff. And then we can prepare you for postpartum. And because then if in a perfect world, if you've seen us during pregnancy, then we know you, we know your body.
Mhm.
Then you have the baby, and then you come back around 4 to 6 weeks postpartum. We
Okay.
process your birth with you, and then we can also address any issues that have come up, because the one thing, and this is what we always tell people too, it's like in those first 6 weeks, your baby, and really in the first year, your baby is going to your pediatrician every couple of weeks to every month to do something, right? To get a vaccination, to, just do a well visit, to, It's very baby focused. You see
Mhm.
your OB or midwife one time,
That's right.
usually at 6 weeks, and they quote, "clear you," and I put this in air quotes for people that are,
Yes.
listening on the podcast, um, but man, it's like that doesn't mean anything. They're clearing you for their area of expertise, and
Right.
that means nothing about getting back to exercise or pain-free intercourse or anything around that, and so that's where a pelvic floor therapist can sort of pick that up and get you back to wherever you wanted to be, and if you're gonna have another kid, then preparing for another birth and delivery and being pregnant again and, helping you through
Totally.
that whole first year, honestly, is, like, really helpful.
Well, I think every woman needs a pelvic floor therapist,
Yeah.
postpartum at minimum, for sure.
Yes. Yes.
And to really, I mean, I just think it should just be in the conversation as part of that 6-week
Exact
follow-up clearance appointment that you're having with your OBGYN to
Yeah.
be like, "Hey, make your pelvic floor appointment because."
And the thing is like that happens, Tina, in every other aspect of orthopedic care. So if anybody's ever had any sort of orthopedic thing or knows
Mhm.
someone that has, you have a knee pain or problem or surgery, it's automatic rehab.
Post-op.
If it,
Yeah,
it's
post-op.
automatic, it's
Totally.
no ifs, ands, or buts about it. And for whatever reason, during birth, it's like 6 weeks, cool, you're done. Go ahead and get back to running when you feel good. Where it's like that running is a big deal and stuff like that,
Yeah,
and you also have this baby to care for. If you had a C-section, you have a major abdominal surgery to recover
right.
from.
Mhm.
If you have any sort of vaginal tearing, like you have torn through pelvic floor muscles that
Mhm.
are needing to function well and that need to expand if you're going to have intercourse pain free. And so there's just so many things that we can support you with. And so we just highly encourage that everybody start to just have that be automatic. And I'll say this too, sometimes, and I understand this more now than ever. I understand that especially in the early postpartum phase, and I would say that that's like from 0 to like 6 months, honestly, that it can feel really overwhelming. Everything is focused on the baby. Your hormones are all over the place.
Right.
If you're, breastfeeding, then that can be a challenge, and it can feel really difficult to like take time away from your own. It could be even just an anxiety producing to leave your baby. You know what I mean? But
Right.
I would say that once you're postpartum, you're always postpartum, and so it's never too late to get help either. So we're talking about getting early intervention, but if you want to come and it's been 6 months or 6 years since you had a baby, then we can totally help you too. There's no judgment on you didn't miss a window of opportunity, and I think that's also something that's really important for people to understand is that it's never too late to get help,
Mhm.
ever.
Right, the perfect timing is your timing. When you're
Yeah.
ready, when you're able to carve out that time and you feel comfortable leaving the baby, leaving the house, and yeah, I agree with
All
that
of that.
completely.
And that on the flip side of that, that being said, nothing gets easier to treat the longer it's there. So if
Mhm.
you do have an issue and you're putting it off, um, I would highly recommend you come sooner rather than later
For
if that
sure.
works with your life. Do you know what I mean?
Right,
So it's a
right.
both and situation. We can help you at any time, but also if you know that you have an issue, you might as well get it fixed sooner rather than later. Kind of
Yes.
like if your car was making a weird sound. Sure, you can ignore it for a
Or
little bit.
the yes, the light keeps going on.
Right. But
Yes,
eventually you're gonna have problem or even a bigger problem if we don't, address that soon enough. So that's just another little nudge to prioritize yourself when you feel ready,
definitely.
to do that too.
And I think having the awareness is so important as a mom, as a postpartum gal, just knowing like, okay, what's happening with me and
Yeah,
really
and
tuning in and paying attention to those things because
yeah,
as we all know, mom is the center of the household. So
mhm,
we have to be well and for everything to be balanced at home.
absolutely. And
So
I would say too that the thing that I've realized most, I have a 2-year-old at home and I'm about ready to have a baby at the timing
yay!
of this podcast, right? Thank you so much, Tina and team.
Congratulations.
But, I think that the other thing that I didn't realize until I actually had a kid too is that, anything that happens postpartum gets magnified because your baby's growing so fast too. So it's like suddenly you're chasing them around. they're getting heavier, they're getting
Right.
more
Yeah,
active,
totally.
you're, like, trying to catch up to them, and if you don't ever take time to, for yourself to sort of heal from that whole experience, then you're essentially, like, caught behind a little bit. You're always trying to catch up, right?
Makes
And
sense.
so I think that getting some postpartum care, both on your end and on ours, can really
Mhm.
help you to stay at least ahead or at least closer behind than you would otherwise. And really prepare for if you're gonna have another baby, then you're optimizing your whole body and womb space and all of the things for to welcome another life, you know what I
That's
mean?
right.
And so I
Yeah,
think that it's really important to also think about it that way too, that it's about optimizing. It's not just a reactionary thing like, "Oh, I can only see us, your specialty and mine, if something's going wrong." You can
right,
also
right.
do it when you're feeling great and you wanna just optimize this time
Absolutely.
as well.
Prevention
So we
and
get into
optimization.
wellness. Yes, is the new flex, you know what I mean? So,
Yeah.
and it goes for pelvic floor therapy as well.
Well, I think the ancient Chinese medicine, methodologies of how they take care of moms after they deliver is the way we
Yeah,
should do it. And not
totally.
just in Asia, but like in other countries too, where you're cared for by your family, and they
Mhm.
support you in taking care of your baby. They cook, they clean for you, they make you herbs, and they know how important it is for that 30-day recovery period for
Yeah.
you to nourish your body and get well. And I always joke around about like Asian grandmas, they selfishly want you to get better sooner and have a good postpartum recovery so you will be back on the bandwagon of having another baby.
Right.
Right?
So that
So
they're
kind of
all
like
excited.
talking about prevention and optimization, like you were
Totally.
saying with pelvic floor health to get you ready for potentially that next pregnancy that you're going to
Yeah.
be having in the upcoming years.
Yep.
So I think that it's so great to be able to have resources like pelvic floor therapists like yourself. And Nicole, it's amazing what you've done in the last decade, like the education, how much you've impacted your profession, the patient care. And I mean, I'm just so honored to know you and just,
Thanks.
call you a sister in wellness because I just, even like reading your bio, I was just gushing over like all the things you've done in the last
Oh,
several
thanks.
years. And I know that you yourself have had a personal journey too through this.
Yes.
And I hope you don't mind me asking you to share a little bit about your own journey, because I'm sure it's impacted the way you practice and some of your teachings as well.
Yeah, absolutely. I've been super open about it. I have my own podcast for practitioners, actually, for pelvic floor therapists, and I think that some of the things that I've gone through have completely changed not only the way that I teach other practitioners, but that we train my staff at Pelvic Sanity. So just a little bit about me, and this we might need to put like a little. I won't get too crazy with the details, but a little trigger warning on here. We're going to talk about loss and, miscarriages and stuff like that here. But so I first met Tina in 2019 when I got pregnant naturally, without any help and at all. We got pregnant pretty fast, and then I ended up having my first pregnancy was actually a second trimester loss
Mm.
that was really tough, actually. And, looking back, I didn't realize how tough looking back now, I can see how tough it was. But in the moment, I was just trying to press on and get pregnant again and that kind of stuff. And so I had met Tina during that first pregnancy because I was also considered high risk then. I had started some bleeding and stuff like that during that pregnancy that everybody was kind of like, "Oh, that's sort of normal." Mine
Mhm.
persisted a little bit longer. Long story short, is that we ended up, having loss at 16 weeks. And so that first opened my eyes into how have I been in this field for almost, at that time, it was probably more like probably 15, 17 years. And how have I gone through this whole, opening a practice and caring for people in pregnancy and postpartum and not realize how devastating that can be.
Mhm.
And from then on, like I started to train my staff differently on different types of loss, how to talk to people about having miscarriages. I think, when we ask questions about, how many pregnancies have you had? Like, those questions can open up so much for people because it's like, well, how many
Sure.
pregnancies or how many kids do you have? Like, what do you
Mm.
mean?
Mhm.
And all of that. And so fast forward, we tried to get pregnant again after I had a DNC and started to recover from that loss, of which Tina and her team was there for me every step of the way with that, and that was super helpful. But I had a hard time getting pregnant. Hard time being the definition for me because I was over 35 was, we were trying for over 6 months and we had not gotten pregnant yet. And so that was like in the middle of COVID. And my husband and I were kind of like, well, we at least need to talk to a fertility person just to see like where we're at. Cause at that time, I think I was 38 or 39, I think. So we always try really hard to not feel that ticking pressure
Sure.
of that, 40 years old. But, I had had a really robust career before then. We had decided to wait to have kids. And then now we were struggling in this way. And so we ended up, through Tina's help, found some really great, local people to help me decide whether or not I was going to go through the IVF route. Decided to do that. Did 2 egg retrievals. So I'm an IVF mom. So we did 2 egg retrievals. That was really difficult. I mean, I feel like people
Mhm.
don't talk about that very much. And then I got pregnant again with my first transfer, and then had another 8-week loss again. And so that was really tough. And again, I was seeing Tina and her team throughout that whole time. And I will just say too that having that support throughout that journey was so impactful that Eh, just to be able to come somewhere and have somebody understand, like, what you're going through, and not only from a miscarriage standpoint, but just from the whole IVF process standpoint, and seeing a fertility doctor, like, there's just so many appointments and so many things that you have to do and so many injections and so much hormone fluctuations and stuff. It's
Yeah, for
really important
sure.
to see. Yeah. So I had another, now that's loss number 2, pregnancy number 2. And it's just like, gosh, is this ever going to happen? Then we tried another transfer. We failed at that transfer. And then ended up kind of taking a break. And I ended up seeing a really great mental health therapist who
Mhm.
I think she's been on your podcast too, right?
Yes, she has.
Yeah.
Malika.
Yeah, so I finally was like, "I can't do this anymore by just by myself." I was, kind of burying myself in work, and I had some really big work milestones during that really difficult time, but at the expense of my mental health, to be quite honest. And so, I ended up seeing, Malika Cleland, who is, a friend of Tina. She's been on the podcast as well. She was a lifesaver, and I still am seeing her, that many years later throughout my other pregnancy, which resulted in my wonderful 2-year-old Clay. And then I
Beautiful
also pregnant right
clay.
now as the recording of this podcast, 37 weeks. So we are good to go on that front now. And I know that's not everyone's experience, but man, I think that the mental health component, the having the holistic approach with Eastern medicine has really helped through all of the phases of pregnancy, whether it's trying to conceive, optimizing fertility outcomes for when you go through an egg retrieval or um, a transfer, preparing the uterus to house a baby. Um, and then even you guys have helped me with breastfeeding support and all kinds of stuff. I mean, it's just been a really wonderful, support system that you guys have created over at Revive Chi, and I can be a firsthand experience about the not only just the Eastern medicine, but also the mental health support that y'all provide and just like understanding about what's going on. And then I've seen all my girls at Pelvic Sanity throughout that whole time to make sure I've
Wonderful.
optimized my pelvic health.
Sure.
And so yeah, so I get it from that perspective, and it's completely changed the way that we ask about pregnancies, that we talk about miscarriages and loss, because I feel that, so many times when you're filling out forms, and even to this day, when you're filling out those forms at your OBGYN's office and they sort of callously ask, "How many pregnancies have you had? How many miscarriages? How many abortions? How many this?" And it's just like, man, those questions can really, like, trigger a lot of emotions, and even someone as healthy now mentally as I am to talk about this stuff through the help of, Malika and stuff, like, it still makes you stop and think. It's like, man, that there's a lot to those questions. And so I think that's one of the biggest things that we have changed at Pelvic Sanity is how we ask and also how we respond. Because the other
Mm,
thing is that I know how it feels too to, okay, well, they must really want to know. And you write down all the things and then no one asks about it again.
right. Right.
And
They
it's
don't
just
even
like,
talk about it. It's just like a checklist off a
yeah,
questionnaire
and you're
and
kind of like, "What in the hell? Like, what is happening?" I thought you
right.
wanted to know. Isn't
Mhm.
that part of, like, something you're gonna to talk to me about? So, at Pelvic Sanity, we always are thinking about optimizing, and we wanna look at, like, what has led you up to being here, and whether or not that's directly responsible for anything that you're going through right now with a pelvic floor symptom, or it's just been a mode of grief and a sense of loss and a sad time that we need to be aware of that your nervous system might be a little bit on guard for. Like, that's an important piece for us to know, if we're going to treat you in the best way possible at our clinic. And so I feel like in a way, I know sometimes it sounds crazy when someone says like, "Oh, even those losses has actually helped me, and I'm actually thankful for them." If you were to ask me, would you want to go through that again? I would say absolutely not. I would much rather have just had a easy journey. However, I do think that I've learned a lot from that experience, just having gone through it
Mm.
myself, and I can be excited now that I can help my clinic and through my teaching of other practitioners by extension, just know how to navigate those times with patients a little bit more empathetically, I think has been a really big change for me.
Wow, that's incredible, Nicole. And I'm just hearing you share that story just like gets me like choked up a little bit because I
I
just,
know.
we've been through a lot
A
together
lot.
and I am, so I feel really just privileged that you trusted us with your care and that we were able to be there for you and your family. And I'm just so happy for you that you're having baby number two. And
I know, any day now, it's, like, so exciting.
yes, yes, and taking this time too, so close to your delivery to be on our podcast. So I'm so grateful, Nicole.
Yeah, well,
And
thanks.
uh,
I'm always about spreading the word, and I think the more that we
yeah,
talk about this stuff, the easier it is. I feel like in our culture, there's just so much taboo around all that, and especially in this current political climate, we can't talk about that kind of stuff without talking about managing and having abortion care for things like that.
mhm,
And so it becomes a dicey subject, I think. But I think the more that people that feel comfortable talking about it talk about it can help just to shed a little bit more light that it is a complex subject that
sure.
comes with a lot of charged emotion and feelings, and, I'm just happy to be able to be at a mental place that I can talk about it and that I can affect change in my field, by helping and hopefully helping others to, do the same so we can support our patients the best way possible.
I'm sure that they feel very supported in that way, especially because this is an area that is glossed over a lot. And I think that,
Tons.
yeah, and you just want to be, and so much of your history is related to the physical manifestations of imbalance, pain, discomfort in your body, right? And it's
Yes.
like you can't ignore that.
You can't. I fully believe that now, and having lived both that holistic world, the Eastern medicine world and the Western medicine of, like, all because you have to be grateful for the advances in assisted reproductive technology too, to
Sure.
be able to even have this conversation, even
Mhm.
35 years ago, this wasn't even a thing, you know what I mean? So I feel like that in and of itself, I feel like the blending of those two areas is really important for everybody to sort of understand. And then whether or not you've actually gone through this, somebody who has struggled with in some form or fashion with infertility. I think the numbers now are like 1 in 8.
Mhm.
I think that I even saw a study that was, maybe even saying 1 in 6, couples, have issues and stuff, and so it's not like you don't know somebody that has it even if you don't have firsthand experience.
Right, and I think more and more people are speaking out about it now. I think it was definitely 10 years ago more of a taboo subject
Mhm.
about especially miscarriage, like, people
For
did
sure.
not talk about having a miscarriage, let alone talk about having problems getting pregnant, but now it's a more open topic, and I'm so happy that people are able to talk about it because I think that's part of the healing. Is
Absolutely.
right? Being able to speak about it, to find support, and yeah, just kind of and even connect with other women that are going through something similar, whether it's through a support group or like what you said, someone like Malika Clellan being able to provide you
Yeah.
with some of the mental health support, EMDR, some of those
Yes.
cool things that can really help you through those difficult times and
Mhm.
allowing you to heal from those difficult times and come into a space where you're ready, and then as you know, you've taken, I mean, gosh, you more than anyone else knows this journey of spirit babies, right? We can have a whole nother
Oh,
podcast about spirit babies,
we
but
could have a whole nother podcast
yes,
about
we
that,
can.
but yes, I mean, just
But
that whole other realm of yeah, of opening up to that yeah, that whole possibility
Mhm.
of not only not only Western medicine, not only Eastern medicine, but that spiritual well-being, I think, is a
Yeah,
huge
for sure.
component too, to tap into with whatever, um, spiritual journey you're on. I feel like that is something to make sure that you are healing as well,
Mhm.
because I feel like that's like a trifecta approach to there,
Definitely,
you know?
definitely like that trifecta. Make sure
Yeah.
mind, body, spirit, you're
Yep,
all
exactly.
it's all
Huge.
like intact,
Interconnected.
homeostasis, it's all balanced out just right. Well, I can talk to you forever and ever, Nicole, but I know that, we probably should wrap it up, but I'm going to share all of your contact information. Is there anything coming up for your clinic, for pelvic sanity, any events or talks coming up that you'd like to share about?
Yeah, we don't have any actual specific talks right now, but we are going to one of my goals, especially after I come back postpartum. So in the second half of the year, we're going to do a lot of patient education webinars on different topics that are going to be completely free. So the best thing to
Amazing.
do is to follow um, Pelvic Sanity on Instagram, and you'll be able to, and you can go to our website, pelvicsanity.com, and get on our email list, and you'll hear about all of those free offerings that we're going to do. We're probably going to do a free screening sometime here in, I believe it's going to be May or June. I will still be on maternity leave, but my amazing office staff is going to have some free screenings and stuff. So just make sure to watch Instagram, and if you can grab to get on our email list, you'll get a lot of information on there as well. We have a blog on our website. We do a lot of free content in general, but we're excited about adding these in these webinars.
Awesome. Thank you for sharing those resources. That
Yeah, well,
sounds
thanks so much, Tina, for
amazing.
having me. I really appreciate it. I'm glad to spread the pelvic floor word.
Yes, and thank you so much for all that you do and wish you the best of luck with this next phase of being a mom, baby number 2.
Yeah,
And
cool.
of course, you know where
Thanks.
to find us if you need any extra support too.
Yes, absolutely. Cool.
All
All right.
right.
Well, thanks so
Thanks,
much.
Nicole. All right, take care.